Welcome back to Have More Babies. Now, hold on. Before you think we've totally switched gears. No, we haven't. While our title is about planning for the next generation, today we're tackling something vital for every generation in the family: managing healthcare. Specifically, making sense of Medicare. Okay, let's unpack this. We heard from you. You needed a quicker way, sort of a comprehensive look at Medicare Advantage plans, what people often call Medicare Part C. You shared some excellent deep dives on the top providers for 2023, and well, our goal today is to cut through that complexity, make sure you understand what this choice really involves.
Yeah, it's a really interesting space, actually, because Medicare Advantage sits right where public insurance meets private companies. And that means, well, there's a lot of choice out there, which is good, but it also makes things, complex. So today, we'll define these plans, look at how they stack up against original Medicare, and importantly, get into what makes the top companies different, what they actually offer.
Okay, sounds good. So, segment one, what exactly is Medicare Advantage, or Part C? Let's start with the absolute basics. At its heart, it's basically a different path, right? A way to get your Medicare benefits through a private insurance company instead of, directly from the government.
Precisely. These private insurers have contracts with Medicare. They have to provide everything. Original Medicare covers Part A, that's your hospital insurance, and Part B, your medical insurance. That's the baseline. But the real reason people look at MA plans, it's the extra stuff, the additional benefits they bundle in.
Ah, the bundles. That's where it gets interesting and maybe a bit
Yeah.
confusing. Our sources really highlighted these aren't just small extras. We're talking major things like prescription drug coverage. That's huge for many people.
Absolutely crucial. And beyond drugs, often vision care, dental work, even hearing aids, things original Medicare generally doesn't touch.
And it goes further, right? More towards like overall wellness.
Yes, exactly. Many top plans are moving towards that. They include things like fitness programs, maybe gym memberships. Some even offer transportation to doctor's appointments, which, that can be a game changer if getting around is tough.
Okay, so structurally, how's it work? It's all about networks, isn't it?
Pretty much. When you enroll in an MA plan, you typically pick a primary care physician, a PCP, and you generally need to get your care from doctors and hospitals within that plan's network.
That's the managed care aspect. It helps coordinate things, keeps costs maybe more predictable.
That's the idea. They can use shared systems, electronic health records,
Right.
makes care potentially more seamless. But, and this is important for you listening, if you're used to the freedom of original Medicare, where you can see almost any doctor who accepts Medicare,
Anywhere in the country, basically.
right, then this network structure, that's probably the biggest single adjustment you need to think about. It's a trade-off.
Got it. And just quickly, who's eligible? It's not just seniors, is it?
No, that's a common misconception. While most people on Medicare are 65 plus, younger individuals with certain long-term disabilities can also enroll in Medicare Advantage plans. The sources made sure to point that out.
Okay, good clarification.
Yeah.
So let's move on. Segment two, comparing Medicare Advantage versus original Medicare. This is the big decision point for a lot of people.
Yeah, it usually boils down to, let's say, three main things: the benefits, the cost, and the accessibility, or the network freedom we just talked about.
Okay, benefits first.
Ah,
This seems, well, pretty straightforward based on what we just said. Original Medicare is just Part A and Part B, government funded. MA plans have A and B, plus all those extras: dental, vision, drugs, maybe fitness.
right. On paper, for benefits included, MA plans generally offer more. It's kind of slam dunk in that column.
But then comes accessibility, the network thing.
Exactly, the trade-off. Original Medicare. Huge freedom. See, pretty much any provider nationwide that accepts Medicare, Medicare Advantage, you generally have to stick within their defined network of doctors and hospitals.
And this is where we probably need to mention those acronyms, right? HMOs and PPOs. The sources touched on these.
Good point, yeah. Most MA plans are HMOs, health maintenance organizations. With an HMO, you really need to stay in network. Usually need a referral from your PCP to see a specialist. Pretty restrictive, but often lower cost.
Okay, so HMO is tight network, maybe lower cost. What's a PPO?
PPO is a preferred provider organization. It gives you a bit more flexibility. You can go outside the network with a PPO, see doctors who aren't contracted.
There's always a but.
But it'll cost you more, usually quite a bit more than staying in network. So PPOs offer flexibility at a higher price. If you travel a lot, or maybe split your time between states, that PPO option, or maybe just sticking with original Medicare might be worth considering despite the potential extra cost or hassle.
Right, okay, now costs. This is where it gets really interesting, maybe a little counterintuitive, because MA plans often boast about having really low, sometimes even zero monthly premiums. That sounds amazing.
It does sound amazing, and it's a big draw. But you absolutely have to look beyond just that monthly premium. It's only one piece of the puzzle.
Because the other costs might be higher.
Potentially, yes. While the premium might be low, your out-of-pocket costs when you actually use healthcare, things like deductibles, co-payments, co-insurance, they could be higher than with original Medicare, especially if you need a lot of care or, like we said, go out of network with a PPO.
So you might pay less each month, but more when you actually go to the doctor or hospital.
That's the potential trade-off. Let's break down those terms quickly. Your deductible is what you pay before the insurance starts paying anything. A copayment is usually a flat fee, like $25 for a doctor visit. Coinsurance is a percentage. You might pay 20% of the cost of procedure after you've met your deductible.
And with MA plans, those copays and coinsurance amounts can be all over the place, depending on the plan.
Exactly. They vary significantly. So maybe think of it like this. The MA plan might be like getting a car with a really low monthly lease payment. But the cost per mile if you go over your limit, or the repair costs if something goes wrong, those could be higher. It's a calculated risk based on how much you expect to drive the plan, so to speak.
That's a helpful analogy. But there's a safety net, right?
Yeah.
Something about an out-of-pocket maximum.
Yes, and this is crucial. MA plans have a yearly limit on your out-of-pocket costs for covered Part A and Part B services. The government mandates this. While the exact limit varies by plan, it means there's a cap on how much you could possibly spend in a worst-case scenario year.
So there is protection against truly catastrophic costs within the plan year.
Correct. Original Medicare doesn't have that built-in annual cap unless you buy a separate Medigap policy. So that MA out-of-pocket maximum is a significant financial protection.
Okay, so boiling it down, the choice really hinges on your personal situation. Your health, your budget, how much you value network freedom versus those extra benefits and that cost ceiling.
Precisely. Are you generally healthy and okay with network limits to get dental coverage and maybe save on premiums? Or do you have complex conditions, see many specialists, and need maximum flexibility even if it costs more upfront? Those are the questions you need to ask yourself.
Makes sense. Okay, let's shift gears then. Segment 3. Looking at the top providers for 2023. You mentioned the market is diverse.
Very diverse. You've got huge national companies going head-to-head with really strong regional players. And they're not just competing on price, they're competing on their model of care. They're selling different approaches to managing your health.
Okay, so let's look at some examples from the sources. Humana was ranked #1. What's their focus?
Humana is really known for emphasizing holistic care. It's not just about treating you when you're sick, it's about keeping you healthy in the first place.
How do they do that? Like practically?
Well, their plans often include robust wellness programs, things focused on fitness, nutrition support, preventative screenings. They might offer wellness credits you can use for gym memberships, sometimes even fitness trackers. It's proactive health investment.
Interesting. Okay, #2 was Essence Healthcare. They talked about an integrative care model. What does that mean for a patient? Sounds a bit like jargon.
It can sound that way, but the practical difference is communication and coordination. Integrative care means the plan actively works to connect the dots between your medical care, any behavioral health needs like therapy or mental health support, and even social services.
So if someone has, say, diabetes, but also struggles with depression or maybe finding stable housing.
Exactly. In an integrative model, their primary doctor, their therapist, maybe a social worker assigned by the plan, they're ideally all talking to each other, working off the same page. It aims to treat the whole person, not just isolated symptoms, which can lead to much better outcomes, especially for complex cases.
That sounds really valuable. Then the list had strong regional players too, right? Like Sharp Health Plan in California.
Yeah, Sharp #3 is a great example of a regional leader. Based in California, known for being pretty affordable, lower copays maybe. But a key differentiator for them is often offering some alternative medicine options.
Oh, like what?
Beyond standard chiropractic, maybe acupuncture coverage, things like that. Stuff that many national plans might not cover as standard. So if you value those kinds of therapies alongside conventional medicine, a regional plan like Sharp might be a better fit, even if it's only available in that specific area.
Gotcha. And way down at #10 was Kaiser Permanente. Their model is totally different again, right? The integrated delivery system.
Completely different. With Kaiser, the insurance plan and the hospitals and doctor groups are essentially all part of the same company. Often they're even in the same building.
So it's like one-stop shopping for healthcare.
Pretty much. They heavily use technology, shared electronic health records. The idea is seamless coordination because everyone's on the same team, same system. Referrals can be faster, less paperwork. If you like that contained, coordinated experience and you live where they operate, Kaiser's model is very appealing to many.
And there were others mentioned, Baycare in Florida, Quartz in Wisconsin,
Yeah.
focusing on specific needs.
Right. Some regionals really target niches. Baycare might have plans specifically designed for people with chronic conditions like heart failure or diabetes, with benefits tailored to manage those conditions effectively. Quartz might focus on, say, telehealth access or transportation benefits.
So the takeaway here is, these top companies aren't just offering generic coverage. They're carving out niches, offering specific ways to manage health, specific types of convenience or coordination.
Absolutely. They're competing on the experience and the model of care, not just the basics or the price tag.
Okay, which leads us perfectly into the final segment. How do you, the listener, actually choose the right plan out of all this variety? This feels like homework is required.
It definitely requires some homework, yes, but it's manageable if you focus on the key factors.
Yeah.
Our sources really boiled it down to about 5 critical things you must evaluate for yourself.
Right, let's list them out. Factor 1.
Factor 1, your specific healthcare needs. Be really honest with yourself. What do you need beyond just basic doctor visits and hospital stays? Do you have ongoing vision issues? Do you anticipate needing major dental work? Figure out which of those extra benefits are truly vital for you now and in the near future.
Okay, assess your own health needs first. Factor 2.
Factor 2, the provider network. This is huge. You absolutely must check if your current doctors, especially any specialists you rely on, and your preferred hospitals are actually in the network of the plan you're considering.
And if they're not?
If they're not, you need to understand the implications. Would you be willing to switch doctors? Or, if you're looking at a PPO, are you prepared to pay those significantly higher out-of-network costs? Don't assume your doctors are included. Verify.
Verify the network.
Got it.
Factor 3.
Factor 3, costs. And we mean all the costs. Don't just get swayed by a $0 premium. Look at the deductible. Look at the co-payments for doctor visits, specialist visits, hospital stays. Check the coinsurance rates. And critically, compare the annual maximum out-of-pocket limit. That limit is your real financial safety net.
So look at the whole cost picture, not just the monthly bill. What's factor 4?
Factor 4, prescription drug coverage. Super important. First, does the plan even include drug coverage? Most do, but not all. If it does, you need to check the plan's formulary.
Formulary. That's the list of covered drugs.
Exactly. It's the list of medications the plan covers.
Right.
You need to find your specific medications on that list, see what tier they're on, because that affects your copay or coinsurance. Also check rules like needing prior authorization, and look at pharmacy options. Can you use your local pharmacy? Do they offer mail order?
Check the formulary for your specific meds and the rules. Okay, one factor left. Number 5.
Factor 5. Quality ratings. Don't just rely on the plan's marketing. Look for objective measures. The Centers for Medicare and Medicaid Services, CMS, publishes star ratings for Medicare Advantage plans.
Ah, the star ratings. Like restaurant ratings.
Sort of, yeah. They rate plans on a 1 to 5-star scale based on things like patient satisfaction surveys, how well they help members manage chronic conditions, customer service, complaints. It's a really valuable, independent snapshot of plan quality and performance. Definitely check the star ratings.
Needs, network, costs, drugs, and quality ratings. Okay, that's a solid checklist. So wrapping this up, wow, that was a lot, but incredibly useful. The big lesson seems to be that picking a Medicare Advantage plan isn't just about finding the cheapest option. It's about a really careful, personal evaluation. Matching your health needs to the plan's coverage, its costs, and crucially, its network.
It really is a personal calculation, and making that calculation confidently, whether it's for you or for a family member, well, it helps to have clear, reliable information and resources.
Absolutely. And on that note, if you are looking for more helpful tips, more resources, maybe some easy-to-read guides to help you make these important healthcare choices for your family at any stage of life, we strongly recommend you visit omegapediatrics.com. They've put together a great collection of materials specifically designed to help you sort through complex topics like this one and really understand how to apply the information to your own situation. So again, that's omegapediatrics.com. And of course, if you found this deep dive helpful today, please do take a second to like this video, Subscribe to our channel so you don't miss future discussions, and maybe share this with someone else you know who might be navigating these Medicare decisions.
Definitely. And maybe a final thought to leave you with. The best Medicare Advantage plan isn't always the one with the lowest premium sticker price. The best plan is the one that truly fits your expected healthcare usage, gives you access to the doctors you trust, and aligns with your budget reality. Remember, just knowing this stuff isn't enough. The real value comes when you understand it and actually use it to make informed choices.
Well said. We'll catch you on the next deep dive.
Goodbye for now.